Patients that come in with a droopy eyebrow may have a droopy eyebrow alone or may have droopy eyebrow in relationship to droopy eyelid skin, and the combination of the two may contribute to what a patient perceives as a droopy upper eyelid. We can address a droopy eyebrow in a number of different ways, and some involve external incision lines, some involve internal incision lines, some involve hairline incision lines or incision lines behind the hairline. And it's helpful for us to discuss with the patient how we can best meet their needs, and that will help us determine the approach.
There are a variety of brow lifting procedures that can be incorporated, and most of these are commonly combined with either a blepharoplasty or a ptosis or droopy eyelid surgery. If you were to ask facial plastic surgeons what's the gold standard or the best aesthetic or cosmetic procedure to elevate the brow, that would be the endoscopic or small incision brow lift. In this procedure, incisions are actually made behind the hairline in 5 locations, such that a fiber optic instrument can then be brought over the surface of the forehead to release all of the brow tissue. Once the brow tissue has been released, microsurgical instruments are used to release the central brow depressors that cause vertical frown lines, and then everything is lifted superiorly and secured in place with absorbable anchors. The absorbable anchors are actually made out of the same material that dissolvable sutures are made out of, but it's been polymerized into a plastic so that it maintains the position of the brow. An alternative approach, or the old gold standard type of brow lift, was what's called a direct brow lift. This is a procedure that I typically perform in men that are slightly older, that have deeper furrows in their forehead, because we take tissue out above the eyebrow. When we do that, it does leave a visible incision line. For individuals with very fine or sparse brow hair, this is not a good procedure choice. But for older men that have thicker, darker eyebrows and more furrowed foreheads, you can get away with this procedure, and it provides a very dramatic and outstanding brow lift. The final type of brow lift is called an internal browpexy. This is probably the most common procedure that I perform because it's deemed both functional and cosmetic in nature, and it's easily employed through a transblepharoplasty incision. So for example, if I'm doing a droopy eyelid surgery or I'm performing a blepharoplasty, I can go through that same incision, and then all I need to do is dissect under the brow up here and place some fixation sutures to help lift the central as well as the temporal aspect of the brow. Because it's so easily incorporated through an eyelid crease incision, it's a commonly performed procedure and a nice adjunct because it buys longevity with the surgery. People will often ask me, how long does a blepharoplasty last in terms of its staying power? If you perform an internal browpexy, that's going to provide 2 fixation points or set points that are going to slow down the rate of subsequent brow descent, and it will buy you more time with perspective to the longevity of your procedure.